Yeah, I think, people don't realize, when I look at the Urban League, social workers have,
Right.
been there and influenced that in so many ways. And of course, a lot of times I guess people, don't know, but I really feel that there must be a way that we can bring young people into contact with social workers. I got excited the other day. We had a group of students from all over to come and here on Capitol Hill, and I had an opportunity to address them. And I said to them, I'm here to recruit. I want to recruit some folks to run for office. And of course, they sort of giggled, about it. But the point was that, I'm very serious.
Right?
Yeah, I'm very serious. I just would like to see more social workers get involved in the political process, because I really feel that the training makes him or her a natural in the business.
But you have several social workers in your staff, if I'm not mistaken.
That's
right?
correct.
And quite a few people on the Hill have social workers who are on their staff. They may not be running for office, but they're certainly part of the political process, and we call those political social workers. And we know there are a lot of those around the country, more than we've ever probably recognized. So that's one way to get involved in the political process, is to work for somebody who's a politician. I mean, I think that's a wonderful training ground, and then they might feel comfortable about taking the next step and running for office themselves.
Right. Let me be very basic. Suppose someone came up to you and said, I want to be a social worker. I mean, what would you actually say to them?
Well, I would ask them about what kind of social work they wanted to do. Like, I'm a social worker, but I'm an administrator, but I'm also an advocate. If you look at social work in general, if you look at our Code of Ethics, our Code of Ethics says that we protect and advance the profession, which is very important to us, that the profession survive another 50 years, another 100 years. But the other part of our Code of Ethics says you must work on behalf of social justice. So if you're coming into the profession and you only want to do individual counseling, maybe social work might not be the best fit for you. Maybe psychology or counseling would be a better fit. But if you're coming into a social work position, you can be the counselor, but you also have to be the advocate. And I think that's what sets social work apart from all the other helping professions, that we have a mandate. Our Code of Ethics says that we will work on behalf of social justice. I think that's really important. So if someone said to me, I want to be a social worker, I wouldn't certainly say several things. I get tired when people say, well, it's God's work. It may be God's work. And then they always add, but you'll never be paid very much. And that's not true. Many people have made a very good living at social work. Many people do struggle with salaries, and we're concerned about that, and that's part of the bill that you've brought out. But I don't want people to have the self-fulfilling prophecy that if I go into social work, I'll have to give up my life. So I say to social workers all the time, you deserve to have a house and a car and a family like every other professional. And so we need to help get over that hump of, if you're going to do social work, you're going to be poor. There's no reason for that. We pay teachers, we pay nurses, and they're predominantly female professions. Social work is 80% women. You're in the minority in the social work profession. But I think it's an important component. And I think what we don't do well as social workers is advocate for ourselves. We are really comfortable advocating for our clients or our communities, but we're not as comfortable advocating for ourselves, for our own salaries, for our own workplaces. And that's some of the ways huge caseloads come about. That if an agency says we're going to have to lay off half our social work staff, and you know it's going to be untenable, there's no way that the staff who are remaining can double their caseload, social workers still stay because the need is so great. And eventually, as you said, people find themselves in difficult situations because the agency has just said you can do more. Well, there's a limit. We don't say that about nurses. I used to be a hospital administrator. You don't say we're going to have one nurse handle 2 floors. That would never happen in a hospital. But it does with social workers. So I think what social workers have to do is stand up for themselves better. And I think your bill is going to allow them to do that.
Right. I think that because, a lot of times, we hear, and you read stories in the newspaper about, how the social worker dropped the ball. You don't see the fact that the social worker was taking care of 2 caseloads when,
and maybe working evenings and weekends to try and get things done. We had a social worker here in D.C. put in jail a couple years ago because she didn't get a report into a judge on time. And that appeared on the front page of the Washington Post saying social worker jailed because she drops the ball or something like that.
Yeah.
And when you looked at what her schedule had been like and how she had been working every weekend for months trying to keep up with the caseload, and yet she was penalized because she couldn't do the job that nobody could do. And I think that's one of the things we have to look at, that I think we've got safety issues, as you said, we have caseload issues, we have numerous issues out there that the social workers are struggling with right now. If you go back 50 years when Dr. Haidt was really instrumental in some of these things that we're talking about, at that time our government invested in the social work profession. We had all kinds of stipends and paid fellowships, and we trained social workers and paid them to work in the social work field. We had lots of opportunities for them, and that's when the social workers at the VA originated. I mean, the VA, as you know, the Veterans Administration, is the largest employer of social workers. They employ almost 5,000 social workers. But there was a period of time when there was one social worker at the VA, and the social workers worked together to say, we need this kind of help, and we do need help, and we'll need more in the future with our returning vets from the current wars. So it's really important, but I think we have to think a little bit about how we help social workers make their own case.
Right. That's the reason why I think that was important today to sort of make the point that social workers really need to talk to their member of Congress.
Yes.
To try and get them to support this legislation, because I think this legislation could do a whole lot. I really feel that, first of all, it will highlight the fact that the social work profession is doing certain things that people are not aware of. I think that's number one.
Visibility.
Yeah, visibility. Like when you said 5,000 social workers, hired by the Veteran Administration. People just would not have any idea. But the point is that they need even more, because as soldiers return with all kinds of problems, so they need help. So social workers are definitely there. The other thing is that if they talk to their members to sort of get them on board with this legislation, then I think it's a strong possibility we can get it passed, and at the same time begin to look at the salary scale for social workers. Now, you mentioned that 35,000 come on board every...
At the bachelor's and master's level.
Bachelor's and master's together. How many retire?
Well, that's a good question. The average age of our member is 52. So, like nurses, we're seeing the baby boomers start to retire. We're very concerned because we already can see a shortage in child welfare and in aging. We know we don't have enough social workers. In fact, several years ago, the National Institute of Aging came out and said that by the time we reach the year 2000, we would need 70,000 gerontology-trained social workers. Well, we got to the year 2000, and we only had 3,000 gerontology-trained social workers. So we were 67,000 short. And you think about what's happening in our country and the aging of the population, we're going to see more need for social workers in gerontology than ever before. So we have a shortage there, we have a shortage in child welfare. But yesterday I was at a meeting of oncology social workers, and we saw on the news this week where cancer death rates have gone up again. And we know that age is the greatest risk factor for cancer. So as the baby boomers age, we're probably going to see more cancer than we've ever seen before. Yet we only have 1,000 oncology social workers out there right now. So these are areas that we can point them at: school social workers, whether you're talking about nursing homes who don't have social workers, hospitals that have a shortage of social workers. We know there's a shortage there. So if we can get the legislation with the commission, the Social Work Reinvestment Commission, to study the profession, to say this is an issue for us. I mean, we've watched this happen with nurses and teachers and other professions, physicians. I noticed yesterday there was an article in U.S. Today about the lack of surgeons in many areas. Well, in many rural areas, the social worker is the only mental health professional there. There is no one else. There's not a psychiatrist, there's not a psychologist, there's only a social worker. So if you take that social worker away, the community misses out on mental health services. They also miss out on some of the community services and the community development that we need.
Right. What are some of the things that we can say to our colleagues in terms of as to what they might be able to do to sort of help us move this legislation along? Because I really see this legislation as being very, very important, because I think that every profession has to be evaluated along the way, and that also it needs to be supported, especially when the need is as great as you know it is and I know it is. How do we get our colleagues to sort of be responsive in terms of getting information to the member of Congress, whoever needs to be talked to encourage them to move and to support this legislation? How do we speak to our colleagues?
Well, actually,